Hello, my name's Myron Kanagaratnam and I'm Programme Director for the Child and Adolescent Psychiatry Training Scheme here at the Tavistock Clinic. And this film is part of the Digital Open Day celebrating the centenary of the Tavistock. In particular, we're going to be looking at some of the history of child psychiatry here, as well as what it means to train in this discipline in 2020. Over the years, many distinguished child psychiatrists have worked at the Tavistock. Foremost was John Bowlby, who was internationally recognised for his groundbreaking research and development of attachment theory. In 1946, Bowlby was appointed Director of the Child and Parent Department. His influence was substantial. He brought an increasing recognition of the role of the environment in clinical work, in particular the child's experience of family relationships and school. He was instrumental in the development of training, inviting Esther Bick to set up the first child psychotherapy training within the NHS. Bowlby also set up academic seminars for the trainee psychiatrists. This photograph shows Bowlby on the right leading one of these seminars in around 1977. The man on the left, leaning back rather nonchalantly, is Sebastian Kramer, a registrar in psychiatry at the time. Sebastian later became the first programme director for child and adolescent psychiatry when the training was formally established in 1984. I'm standing here in that very same seminar room where trainees in child psychiatry continue to have their teaching sessions to this day. And as you can see, the blackboards are still here. But more importantly, Bowlby's philosophy of integrating diverse theoretical perspectives, whilst firmly rooted in the research and evidence base, remain a model for child psychiatrists at the Tavistock Clinic. Over the years, the Tavistock has attracted and cultivated doctors with a broad interest in multidisciplinary approaches to mental health. I spoke to one of our current trainees, Georgie Fozzard, about why she chose to come and train here. So Georgie, why did you come to train at the Tavistock?
I think for me it was largely to do with the access that I knew I would have to different types of therapies training here. So for example, my specialist interest is the psychotherapy training for psychiatrists, which is the M14 course, and as part of that you get to do a year-long infant observation, so you get to sort of really observe the early relationship between the baby and its parents, and then there are also really fascinating lectures with great speakers about psychoanalytic theory and child development. And then the other thing people do a training in is systemic family therapy. And even if you don't do the full course, all the registrars get to do the family therapy workshop on a Monday afternoon and see a case in systemic family therapy. So I found that brilliant. And then of course there's just the history of the Tavistock and the amazing people who've worked here and sort of pioneers really in the field of child psychotherapy and child development. There are so many different ways you can be a child psychiatrist, but the ICD-10 diagnostic criteria are a very, very narrow conception of mental illness, and I think something that we do get here is the ability to be therapeutic in all our consultations. We're dealing with children who are in distress, so the kind of skills we pick up in lots of different therapeutic modalities we can use every day. And then of course there's being able to make an interesting and sort of layered formulation of a child and their family, and I think being able to draw on different theoretical principles, maybe from psychoanalytic theory or from systemic theory or other modalities is very useful in doing that, and then that leaves you much better able to make the right referrals and recommending the right treatment for your children. And then the last thing is that as when we become consultants, we might become leaders in our teams, and we also get a good grounding in understanding the sorts of dynamics that go on within organisations and teams, and I found that really interesting.
Trainees in child psychiatry play a vital role supporting young people presenting to hospital with mental health crises. I spoke to one of the registrars, Kiran Nijabat, about her experience working on call. So Kiran, tell me what it's like working on call.
So working on call can be quite challenging because the SPR is often the first port of call out of hours, and there's limited members of the team around, and sometimes there can be some really tricky scenarios, such as a patient that's feeling has taken an overdose or feeling quite anxious and agitated, and we have to make quite difficult decisions about admitting a patient overnight in hospital, maybe going to an inpatient unit, having to be transferred across to other places. Sometimes parents can be quite anxious as well, so it's trying to manage these kind of various scenarios whilst on call with limited time can be quite difficult for SPRs. I think that the skills required as a child psychiatrist are similar to the skills required for leadership, collecting information, processing that information, carrying out tasks, inspiring others to kind of follow through with tasks. All of these skills, I think, are required both whilst you're on call and also within kind of a leadership role as well.
So how has the Tavistock training helped you develop as a leader?
I think the Tavistock has helped me to develop as a leader on multiple levels. So I've attended the psychodynamics of leadership lectures on the teaching programme for the SPRs. I've also attended a group that's led by Vega Roberts, who's an organisational consultant, and she offers a kind of reflective space for the Tavistock trainees, the SPRs, to be able to talk about various kind of scenarios that require a lot of kind of processing and reflecting on our leadership styles, and it's made me think about what my leadership style is like, and also it's allowed me to reflect on the various leadership discourses as well.
Child and adolescent psychiatry in the 21st century is a rich, diverse and advancing field, with new developments in psychological therapies, genetics, neurobiology and pharmacology. However, most often it's the timeless qualities of empathy, compassion and curiosity which make the most difference to families. Qualities that might seem quite ordinary, but can be compromised at times of extraordinary stress and anxiety. Their qualities are underpinned by core values to be therapeutic in all contacts with young people and their families. It's these values that resonate in the words of our trainees today, and which will continue to remain central to both child psychiatry and the Tavistock as they stride forward together into the next centenary.